Download the Nursing Lecture app and get access to the premium videos, articles, mnemonics, practice test series and chat completely free. Get it from the Play Store. In this lecture, we'll talk about the labor and what are the causes of onset of labor. It means what are the responsible factors which initiate the process of labor. So first we will talk about what is labor. What is the definition of labor? So labor is a series of events that many events are going to take place in a genital tract of a female. Why? To expel out the conceptus, that is the fetus, from the womb, that is the uterus, through the vaginal route, so that the fetus comes into the outer world. So this process is known as labor, and the normal labor is also called as eutosia. Now we'll talk about what are the causes or the responsible factor for the initiation of labor process. So actually the exact cause is not still clear, but there are many factors which help to initiate the labor process. So first we will see the trick in which you can easily see that how these responsible factors initiate the labor process. So the trick is in its name itself. So what is trick? That is Parturition Causes of ONset. So trick to learn the responsible factor for the initiation of labor is Parturition Causes of ONset. Parturition also known as the labor itself. So here P stands for prostaglandin. So what is the factor which stands for P? That is prostaglandin. Now comes the C. C means cortisol. Then comes the O. It means estrogen. Then O and N. O stand for oxytocin and N stand for neurological factors. Neurological factors. So what is the trick to understand the factors responsible for initiation of labor is Parturition Causes of ONset. That is the prostaglandin, cortisol, estrogen, oxytocin as well as neurological factors. So these are the important responsible factors to initiate the labor. So this type of trick and mnemonics you will get from my nursing lecture app. So don't forget to download it. Now we'll see here how this factor initiate the labor. Firstly, the prostaglandin. It is very important factor because it initiate as well as maintain the labor process, because this helps in cervical dilatation. So this prostaglandin make the cervix to become ripen. As the cervix become riped, this help in the softening of the cervix. So as the cervix becomes soft before the onset of labor, further it add in dilatation of cervix. So prostaglandin is very important factor. So from where this synthesizes? It synthesizes from fetal membrane, that is from amnion, chorion as well as from the decidua, that is the endometrium of the pregnant uterus. So prostaglandin is synthesizes from fetal membrane as well as the decidua. It initiate as well as maintain the labor process. Now next comes the cortisol, that is C. Cortisol releases from the fetus and this then diffuses into the placenta, and from placenta estrogen and prostaglandins are synthesizes. So cortisol is releases from fetus to placenta and this will add in formation of estrogen as well as prostaglandin. So from where this cortisol is releases? From the fetal hypothalamus corticotrophin releasing hormone is releases, and this then triggers the pituitary gland of the fetus, and this pituitary releases adrenocorticotrophic hormone ACTH, and that ACTH triggers adrenal gland, and this adrenal gland releases cortisol from the cortex region, and this cortisol finally diffuses into the placenta, and this placenta finally releases high amount of estrogen as well as prostaglandin. From where? From the placenta. Now next comes O, that is estrogen, very important factor. Usually estrogen is released throughout the pregnancy, but the amount of progesterone is more higher in comparison to the estrogen, but at the time of labor, progesterone level becomes decline and the estrogen level rises. So as the estrogen rises, how it is rising? It is rising from this cortisol release. As this cortisol is releases into the placenta, then placenta releases more estrogen. So this high level of estrogen and the fallen level of progesterone, that is the alteration of this estrogen progesterone level, helps further to initiate the process of labor. How? This rise in estrogen level help the maternal pituitary to release oxytocin. What it does? This estrogen help to release maternal oxytocin, as well as this high amount of estrogen further increases oxytocin receptors in the myometrium, and also it synthesizes prostaglandins. So what estrogen is doing here? It releasing maternal oxytocin into the bloodstream. So these oxytocin directly act upon the oxytocin receptors in the myometrium that lead into the uterine contractions. Also it stimulates the synthesis of more oxytocin receptors in the myometrium, as well as the release of prostaglandins. Now next O is the oxytocin. So as I told you before, what oxytocin is doing here? As the oxytocin receptors are increases in the myometrium, what will happen? At term, the uterus become contract, because this oxytocin receptors receives oxytocin hormone, and with this oxytocin uterus become contract, and as the uterus become contract and the cervix become dilate with this effect of prostaglandin, finally what will happen? The fetal will comes down. And the last one is the neurological factor. Although there is no initial nerve supply is required for the initiation of this labor process, but there are the alpha as well as beta adrenergic receptors present in the myometrial layer of the uterus. So what this alpha receptor do here? With this rising level of estrogen, this then stimulate the alpha adrenergic receptors, and these alpha receptors declines the cyclic AMP generation, and this will add in the release of more calcium ion in sarcoplasmic reticulum, and that help in the contraction of muscles. So this is how there is no initially nerve supply for the initiation of labor process, but there are some receptors which add in uterine contraction. So in this lecture we have seen the trick to understand the causes of onset of labor. And what is the trick? That is the parturition causes of onset. And the parturition is the another name of labor. So P stand for the prostaglandin. So what are the responsible factors in this parturition causes of onset? P means prostaglandin, C means cortisol, O estrogen, then another O, that is oxytocin, and the N means neurological factor. So these are the responsible factors which initiate and maintain the process of labor. Thank you.